head control. Specifically, we're talking about how to head control strengthening exercises for babies. Now, if this sounds like your baby, here's the question. I am answering by making this live to answer a specific question that came into me from one of my followers on YouTube. The parent said that when baby was born, baby suffered from asphyxiation. Asphyxiation just means that baby had a lack of oxygen to the brain for a period of time. I don't know how long baby brain was deprived of oxygen, but the result is baby has something called hypotonia. Hypotonia is just fancy speak for low muscle tone. Baby's body feels floppy. Baby struggles to hold their head up. Now, this particular baby is already 9 months old, and the parent is asking about head control exercises. Baby is still struggling to hold his or her head upright. So when I have a situation like this and I'm evaluating a case like this, I always ask the parent a couple of key questions. One, can baby hold their head in midline and maintain that position? If you put baby in midline with their head upright, can baby stay like this with you not having to hold or support baby's head? That's very important. That lets me know where we're starting. We have to start exactly where baby is. You can't start at a point that your baby is not. So you have to, if your baby's not able to hold their head up, then you have to work on some head control. Stability before mobility. I've said that so many times now, I'm sick of hearing myself say it. But there are things that we can actually do for a baby who's struggling to hold their head up. So let's assume that this baby is able to hold their head in midline, but when baby tries to move, their head dangles to one side or the other. Or if baby tries to lean forward, the head drops forward. If baby leans back, the head tends to lean back. So I'm going to show you a couple of different exercises that will specifically target babies' muscles in the side of baby's neck. There are these two big muscles on the side of your neck called the sternocleidomastoid muscles, or SCM for short. And these are the two main muscles in your neck that twist your head, tilts your head from side to side, and rotates your head from side to side. Turn your head from side to side. So we're going to start there. So if you sit on the ground, put your baby to sit on your lap facing away from you like I am sitting right now, and just hold your baby in center. Let baby lean their head back against your body so that baby can maintain that upright position. Now, the next thing I want you to do is take both hands, put them around baby's trunk. What you're doing here is you're giving baby a whole bunch of upper trunk support so that baby does not have to focus on holding their entire upper body upright. Baby just has to focus on being able to hold that little head up. So you're giving baby a lot of support around her trunk. Look at how my hands are. I've got her arms kind of pinned up against her body. And as her arms are pinned up against her body, I can bring baby and put baby on one of my legs like this, with both one foot on either side of my leg. And now I'm supporting baby like this. You can do this with your baby sitting watching television, or just kind of hanging out, talking to another parent, engage with another parent, and you just on the ground hanging out with your baby. Now what I want you to do, the first thing is go slightly to one side and look to see if your baby's head does a move kind of like this, where as you lean baby in one direction, baby's head comes back up. That's called a head righting reflex. If I lean my body this way, my head stays up this way because I'm trying to orient myself vertically to the room. Now, when you lean your baby's body to one side, you want to see this move. And that simply means that you are now exercising your baby's side neck muscles as you lean slightly. I don't want you to do an entire lean like this to where baby's head is hanging and it looks like baby is going to hurt her neck. You're doing it in very small increments, to one side and then to the other side. If you find that you lean your baby to one side and your baby is having a hard time doing this move, here's what I want you to do. Take the opposite hand. So baby is leaning towards her right side right now. I'm going to take my left hand and put it above baby's shoulder and give baby some downward pressure on her shoulder. This will allow the muscles on the side of your baby's neck right here, this muscle on the side of baby's neck, to activate and be able to bring baby's head back up in midline. So what you want to do is put this hand on baby's shoulder, the opposite shoulder. Baby's head is leaning towards her right side. I'm putting my left hand on baby's left shoulder, giving baby some downward pressure going down through her body towards the floor. And now baby is should be able to bring her head back up into midline like this. And if you practice that daily, to both sides of the body, lean baby's body towards her left side, take your right hand, put it on baby's right shoulder to give baby a counter force, and now baby should be able to use that force and bring her head back up into midline. That is a very basic way of going side to side in small increments and cueing your baby to get those head riding reflexes to start to kick in and strengthen the muscles on both sides of your baby's neck. Now, the next activity that I want you to do besides the side bending is what's called a little bit of a backward lean. So I'm going to turn sideways so that you can see it. The eyes and brain correct if you're on your side. The head doesn't automatically right itself vertically. That's not a reflex. I am not sure who this person is. The eyes and brain correct if you're on your side. The head doesn't automatically right itself vertically. That's not a reflex. Actually, when your baby is born, they do have a head righting reflex. Look it up. Anyway, so moving on, if you put your baby to sit like this, I'm going it sideways. Put your baby to sit. Of course, your baby is facing you and I'm sideways, just so that you can see what we're doing. So I want you to lean your baby's body slightly backwards, just so that baby's head can begin to tilt backwards just a little bit, and cue baby to bring their head back up. What you're doing essentially is you're using baby's own head as kind of a weight to strengthen baby's neck muscles. Lean baby backward slightly, cue baby to bring that head back into an upright position, and now you're strengthening the muscles on the front of your baby's neck. As you continue to practice this flexion, essentially like a head flexion exercise where you want baby's neck to go backwards and then just come right back up into midline as you're strengthening baby's neck muscles. So as you practice that, your baby's neck muscles will now be getting stronger. So here's what we've done so far. We've leaned to one side, we've leaned to the other side, and we've done a little bit of neck flexion exercise so that baby's neck is getting strengthened. In the front of baby's neck muscles are getting strengthened, the sides of baby's neck muscles are getting strengthened, and you are then going to move on and we're going to do something to strengthen the back muscles in the back of your baby's head as your baby lifts their head up. And the way to do that is to kind of do the opposite of what we just did. I'm going to reposition myself. If you put baby to sit on your leg, I have baby's legs on one leg on each side of my leg, and I'm supporting baby around her trunk. I'm giving our baby a lot of support around her trunk, and now I'm going to let baby lean that head forward and just bring it upright. If you have a television or something up higher than baby's level, that'll cue baby to lift that head up and be able to look at that toy or look at that object or look at the TV and be able to lift their head up and start developing some strength in the muscles on the back of her neck, the neck extensor muscles. So those are a couple of simple exercises and activities that you can do. As your baby gets stronger and stronger, you'll be able to challenge your baby in more challenging ways. Put your baby to lie flat on their back, pick baby up, things like that. But you want to start off with the basics. You have to start off where baby is and then gradually move forward. This is something that's going to take some time. The person who sent this question in to me said that her baby is getting therapy 2 to 3 times a week. And so this baby is obviously super involved, and this is not something that you are going to watch one video like this, do a couple of exercises with your little one, and then all of a sudden now your baby's neck has been corrected and has great neck control, is moving on to their other motor skills. You want to take your time, do it gradually, and as your baby builds small incremental steps, you're going to continue to increase the amount of stress that you're putting on your baby by putting your baby in more challenging positions as baby continues to get stronger and stronger. If you have any questions or comments while I am live, go ahead and drop the comments in there. Let me look at a couple of questions real quick. Besides from that first one, someone said pseudoscience garbage. Okay, that's an interesting comment. If anyone else does not have any other questions, I will talk to you soon. Take care. Have a great day, and I will see you when I go live this evening. If you have any specific questions, drop a comment down below, ask me your questions, and I will make a live for you. Okay? Talk to you soon. Take care.